Good morning, everybody. Today on the House floor, we will be doing our omnibus bill for Health and Human Services Finance, Public Safety, as well as State Government Finance. We're going to be rolling that out together as one bill that has come out of the Ways and Means Committee. We'll be presenting that on the floor shortly. I'll just speak very briefly to the Health and Human Services portions of that. We have some items in there. Some of the bigger items that we will be looking at is MNsure, looking at replacing MNsure and looking beyond it to solve the problems, to get people the care that they need, where they need it. Dealing with the MA liens issue that has hit people 55 to 65 across the state of Minnesota. Another detrimental factor in dealing with MNsure, another big problem that Minnesotans are dealing with. Also, we're going to be dealing with providing some additional mental health issues for folks in Minnesota. Another big piece of this that we're going to be looking at beyond mental health and MNsure, but we're also going to be looking at trying to get some of the waste, fraud, and abuse out of the system that the legislative auditor has found. Over $270 million over a 5-month period across about 30% of our programs, taking that, putting that into a special revenue account, and putting that aside for home and community-based services for what is commonly known as the 5% Club. So those are three kind of big aspects that are probably we're going to be talking about on the floor, as well as lots of other amendments, and folks from the other side of the aisle are going to present some priorities and differences as well. And with that, that's Health and Human Services. And it's a little over $20 million that we find with savings within the bill. We have a zero target. We're spending no additional dollars for both the general fund as well as the healthcare access fund. That's another important piece within this budget area from last year. With that, I will turn it over to Representative Cornish.
I'm going to be presenting the Public Safety Policy Bill today and Finance Bill. We've got several provisions in it, I think 3 different bills. My bill, or our bill for public safety, doesn't spend any money. In fact, we have a $1 million transfer into the general fund. There'll be some interesting aspects. I think there'll be, from looking at the numerous amendments, we'll have amendments on the Appleton prison, we'll have amendments on background checks, and a number of different amendments we'll be taking up today. I imagine that there will be a lot of debate and go late. The body camera issue will come up. I will be supporting the amendments in theory, but I want this to go through the process, so I will encourage people not to take the body camera amendments today. And I will encourage people naturally not to accept the gun amendments. And so it won't be as exciting as a bill as it normally is, because we don't spend any money. So there will probably be some amendments to transfer money from other members, maybe of the DFL caucus, and we'll address them as they come up. So it should be an exciting afternoon and evening.
So I have the state government finance bill, and what we do with that is we reprioritize spending here on the state level, and we put the emphasis more on our needs for our veterans. We traveled as a committee in the month of February and heard the voices of people that are veterans that are experiencing problems with housing and mental health issues and other things. So we put an emphasis on that. We also emphasize security for our National Guard units and giving them greater security there too, as a number of other items. On the other side of it too, we also ask that government slow the rate of growth and that we have greater accountability and transparency to the taxpayers in Minnesota. So, thank you. Any questions?
Representative Dean, can we start with you? The Health and Human Services bill includes defunding of Planned Parenthood. Why do you think that belongs in this bill? The governor says it's a non-starter. But why do you think this is something that's important to do?
Well, that will be an amendment offered on the floor, Representative Lomer's bill, which actually redirects family planning money from those facilities and just focuses it on federally qualified health centers. So that's what that piece of the amendment does, but it's not currently in the bill. That will be offered as an amendment by Representative Lomer.
Okay, Okay, are you going to support that, and does that belong in the bill?
I will be supporting that amendment, and I think we had very good testimony in our committee about really the needs of folks and how those needs are being addressed in greater Minnesota and in the Twin City area, about access for family planning grants, that those dollars would be better deployed within federally qualified health centers that provide lots of care, comprehensive care for people, not just reproductive care for the health needs of particularly young women in the state of Minnesota.
I'm sorry to belabor it, but why do you think Planned Parenthood should be defunded? Why not just let it go the way it is?
Well, what this is it's family planning grants that will be spent. They will be spent within federally qualified health centers that also provide comprehensive care, eye exams, breast exams, other more comprehensive care that really addresses the total needs of young women in the state of Minnesota. And that's, I think, was a very important part of that committee hearing that we had from the Department of Health as well as from Planned Parenthood, who testified, was that federally qualified health centers are able to provide comprehensive health care for women, and that's why those family planning grants are going to be better deployed there.
So this is not a shot at Planned Parenthood per se?
It's redeploying those dollars towards FQHCs, federally qualified health centers, that provide things like breast exams, eye exams, comprehensive skin checks for women, young girls and women, that go beyond reproductive care, that address the total care of young women.
Isn't the reason for this because of these debunked Planned Parenthood videos? Isn't that why you're doing this?
The money that is actually being deployed is family planning grants. It's going to be going that will be going to federally qualified health centers that provide comprehensive care.
I don't understand why. I don't hear you explaining why. You're saying what you're going to do, but not why.
That those dollars could be provided in a federally qualified health center that provides not just reproductive care, but lots of other comprehensive care that young girls and women need in the state of Minnesota, and that's where that can be best delivered by physicians and other healthcare providers that can do that and provide comprehensive care for women, not just reproductive care. But those the family planning grants can be administered in any FQHC for no money for Minnesotans.
Let's go back to MNsure for a moment. If you're going to basically repeal it, what are you going to replace it with?
What we have in the bill is House File 1664, which will switch Minnesota to a federal system, similar to what we have in Wisconsin or other states, that the 34 states that are on that. More than half of the states that started with Minnesota and the experiment of MNsure on a state-based health exchange have in fact, are in the process of, or already have switched over. After the Supreme Court ruled last year that there's no tax benefit to Minnesota for being a state-based exchange, we've spent $300 million plus on a website that doesn't work, that doesn't provide us any additional benefit. And if that weren't enough, it's actually doing a lot of serious harm to Minnesotans, to counties all across the state. And you've heard them over the years, you understand that, and you'll also hear some more of that today. But we would be switching to a federal program. Within that, we are providing some flexibility now as these other states are abandoning that. They're no longer throwing good money after bad, but are switching over. We're providing a similar path for Minnesota in the years to come. We understand that can't happen overnight. You can't just switch it over like a plug or a pipe. It takes many months, and it requires that. But we also see that what we currently have is not fiscally or stable. It's not paid for. There's no way to pay for it moving forward, and it just keeps getting worse, and it's hurting people. So that's what we're doing.
Chairman Cornish, you mentioned that you support the body cam initiative in spirit, but you're not going to be with the folks who want something done today. How optimistic are you that something will even get done this session on the body cam topic?
Well, I'm really optimistic. The other chair and I are still talking, and I want to honor the process. at some point, we'll have to bring the public in for comment, and that hasn't been done yet. That's always a requirement. We'll have to act fast, but I'm very hopeful and confident that we can put something together in the last few weeks.
And why is it important that something happened this year?
Well, people like Minneapolis PD has invested $3 to $4 million in it. There's police departments and sheriff's offices all over the state that have told us we aren't going to do anything until we know if there's going to be a statewide policy. They want protection for their data, and they want certain requirements that they can put into their policies, and they don't know yet about what we're going to mandate or fail to mandate. So there's a lot of people out there, depending on us to put something together before they spend a whole heck of a lot of money on this, like Minneapolis. They took quite a gamble, and so we want to, honor those wishes if we can.
Speaker Daudt, I wasn't there, but from what I gathered, Governor Dayton had some strong words about something about how he would not negotiate on some of these policy provisions. I think he may have used the phrase Tea Party provisions that are coming in these omnibus bills. Any thoughts?
I didn't hear his comments today, but I would say that from the little bit I did hear about them, it did not very well represent our breakfast this morning. We had a very pleasant breakfast. We talked about a lot of issues. We talked about the process going forward, and he didn't bring up any of those things to me. So I wonder if potentially he was doing that for the cameras. I don't know, but he certainly didn't mention that at breakfast.
The governor says that these bills, these articles today, and all of the bills seem to include what he calls extreme positions of the Tea Party, pandering to your political base. And if you're going to do that, he says, you might as well just go home now.
Well, those sound like a lot of political talking points that are aimed at being divisive and not bringing us together. And unfortunately, we've got 3.5 weeks left. I've been critical in the past for the governor not being involved in the legislative process. One of his deputy chief of staff tweeted out this morning that I don't do press conferences. It shows how much the Dayton administration is paying attention to what's going on over here. This is my 3rd press conference this week. So, I think what we need to do is we need to see the governor engaged more in the process over here. We want to solve the problems that Minnesotans care about. We want to provide tax relief for Minnesotans, for middle-class Minnesotans. We want to provide funding for roads and bridges. And we want to do it in a way that Minnesotans can get behind. And the governor is embracing policies that are not popular with the public. They're failed ideas, and these are things that you all know. I'm not telling you anything you don't know, but the gas tax, 2-to-1, Minnesotans are against that. The governor himself has flip-flopped on it. He said it was the only solution, then he said it was dead, now he's saying it's got to be back on the table. Those things make it more difficult for us to get our work done here, and what we need to do is see the governor coming in our direction. We need to see some compromise out of the governor, and we're not seeing that right now.
Well, the governor says that he's not going to discuss these things because you are considering issues like defunding Planned Parenthood, fetal tissues, transgender bathrooms, that he says you're just pushing for the fall, and that why talk to you if you're doing this kind of stuff, and including some of this in budget bills.
Maybe he needs to read some of our bills too, but I'll send some copies over to the governor's residence. What's that? I'll send some copies of our bills over to the governor's residence so he can read them and see what's actually in them.
By the end of today, or maybe by sunrise tomorrow, all the budget cards will be on the table.
Yeah.
As you know, the Senate bill that they're debating spends much more of the surplus on new programs or augmenting existing spending. Would your members prefer to go home with no budget rather than what kind of the size of surplus spending on new programs?
We feel like we are in a great position because we're on the side of the public. What we want to do is accomplish middle-class tax relief that really will help middle-class Minnesotans who aren't seeing a surplus in their own family budget like the state is. We also want to put some money into roads and bridges and do it in a way that doesn't take more money out of Minnesotans' budgets. We have enough money in the surplus right now to accomplish both of those goals. We know that those are also aligned with the priorities of Minnesotans. So we think we're in a great position, and frankly, I hope the governor will reach out to Minnesotans, talk with them, see what their priorities have been. That's what we've been doing. And that's why those are our priorities. We think we're completely in line with where Minnesotans are at. And I think Minnesotans expect us to get our work done. If for some reason we leave here without accomplishing funding for roads and bridges, it will be because Democrats have laid down a line in the sand that they won't leave here unless we fund controversial trains in the metro area, which are incredibly inefficient and incredibly expensive. Minnesotans do not support that. So we are on the side of Minnesotans, and we want to get the work done that we know they want us to do. And frankly, we want to use the money they've already given us to pay for the things that we know they care about. So if we focus on those things that matter to Minnesotans, there's no reason, and focus on the things that we all agree on here, there's no reason we can't get our work done and get it done on time. Anything else?
Bonding bill next week?
In the future. I don't know when, but
Sometime in May, right?
it'll be coming.
What is the order today of these articles today? What's?
They're all in one bill. I don't know. I guess that would be a question for you guys.
How does this work then?
I think it was HHS coming out first, and then the other two, Representative Anderson's in mine behind public safety and state government finance behind, but on the docket that I've seen, HHS.
Okay.
Stay tuned.
We will.
Very exciting.
Thank you.
Thanks, guys.
Sounds great. Thank you.